Good evening, all of you. So I hope that I'm audible as well as the screen is visible.
Yes, sir, you are audible.
Thank you so much for confirming. So just give me a minute and we'll start now. I hope all of you are doing good and the preparations are all in track. So today we have a session regarding the clinical signs in dermatology. And clinical signs, as you know, that in dermatology, there are a lot of clinical signs, even though it's a short subject. And in most of the diseases, these clinical signs, they play a very important role as well. So if you have gone through the previous year papers and all, so you can always expect some questions on this topic. So we'll consider this as a very high yield topic as well. And it's a very short session today, so we have a half an hour of a session. So during this session, what I've done is I have brought together all those important clinical signs. So what I'll do is today I'll be sharing you a certain case scenario, like what is the finding that you see in a patient, and then you need to tell me that in which disease can we find this kind of finding, and also to be more specific, if you can name the sign as well, so that will make the session much more interesting and more interactive. Okay? So without much delay, thank you for confirming. Without much delay, let's start with the session now. Okay, so we are going to talk about each and every clinical case now. So let's begin with the first case. Now, the condition here is a punctate bleeding spots when psoriasis scales are scraped off. Identify the sign. So here the diagnosis is already mentioned here, that this is a patient who is having psoriasis, and in psoriasis, what is the sign that you can see, where you can see some small punctate kind of a bleeding spots, especially when you scrape off the lesions. Like imagine that I have a glass slide in my hand. I'm going to scrape off the lesions that you can see, and after scraping off the lesions, when you see pinpointed bleeding spots, I'll just zoom this image for you. Imagine ki there are some red small punctate bleeding spots that can be seen. Anyone who can answer what is the name of this very common sign that you can see in psoriasis? Simple question. To start with, we have a very simple and a very common clinical sign that you can see in psoriasis. Anyone? It's okay if you, even if you make a mistake, but try to make a guess. This one, yeah, very good, very good. So this one is called as Opit sign. So this is called as Opit sign. So this sign that you call it as a Opit sign, we can actually divide this sign into different steps. Like just imagine that you have a patient who is having psoriasis. So just concentrate here carefully. So everyone who has answered it as Opit sign, all of you are right. But let's go a little bit deep into it, because if you see the last year or the last FMG paper, you can see that they asked you something about a grattage test. So that is also coming as a part of the same sign. So what happens is, whenever that a patient is going to present to you with a erythematous plaque lesion along with silvery white scaling, that is how a patient presents to you with psoriasis. Now if you take a glass slide and when you start scraping over the lesions, then what happens? The first step, I'll just use another color here. The first step is that there is an accentuation of scaling. There is an accentuation of scaling. So accentuation of scaling means when you start scraping over the lesions, the scaling becomes much more visible. And what is the name of this first step? When the scaling becomes more visible, please remember, this is what you called as a grattage test. This is called as a grattage test. So at this moment, we are not stopping scraping over the lesion. So once you continue scraping over the lesions, then what happens? A shiny membrane appears over the lesion, And this shiny membrane is called as, anyone who can make a guess कि what do you call for this shiny membrane? Imagine करो कि मैं scrape कर रहा हूँ over the skin of a psoriasis patient, or as I continue scraping, that lesion or the scaling becomes much more shiny, like a waxy membrane that appears over the skin. And this shiny membrane is called as Bulkley's membrane. So this is called as a Bulkley's membrane. And I don't stop there. Once I continue scraping over the lesion, that is where I can find some tiny pinpointed bleeding spots, and that is called as Opit sign. That is called as Opit sign. So please remember, before you go for your exam, you can just try to imagine you had a patient and you were scraping over the lesion. First finding that you can see is the scaling becomes more visible, and that is called as Grattage test. That is called as Grattage test. Accentuation of the scaling. As you continue scraping over the lesion, you find that there is a shiny membrane which appears, and this is called as Bulkley's membrane. And once you still continue scraping the lesion, you find something like this, where there is pinpointed bleeding spots, and these pinpointed bleeding spots, we call it as Opit sign. I hope it is clear. So these are the various phases that you can see as you scrape over these lesions in psoriasis patients. So that's about the first question. So if there is any doubt, feel free to stop me and feel free to ask your queries. I'll be happy to answer you. Okay. And if there is no query, I'll just continue to the next one. So now going to the next one. Now let's see what is this. A patient presented with a skin finding in which the top layers of the skin, they slip away from the lower layers when rubbed. So this is an image as well. So if I just apply a tangential pressure over the skin is getting peeled off. That is how I can describe this skin finding in another sentence. So what is this? So the cryptic commenter says it is seen in toxic epidermal necrolysis. Yeah, very good. You're there. That yes, in TEN also you can see a very similar sign. Any other disease? Yeah, very good. It is called as the Nikolski sign. Excellent. So this one is called as Nikolski sign. So this one is called as Nikolski sign. So what is happening in a Nikolski sign is, if I'm going to apply a tangential pressure like this, when I'm going to apply a tangential pressure using my fingers, so what happens is the skin will peel off. So when, in which all scenario you think that a patient can present to you with a Nikolski sign? So can you just try to give me examples जहाँ पे Nikolski sign देख सकते हैं? So Gautam is saying staphylococcal scalded skin syndrome. Excellent, very good, I agree. So that is why I have listed it down as well. Any other diseases जहाँ पे Nikolski sign देख सकते हैं? Any other diseases? Give it a try. Just try to visualize or imagine conditions where skin can get easily peeled off. I'll give you a clue if you want. This can be seen in a condition जहाँ पे flaccid bulla देख सकते हो, which means bulla which can break very easily. That is another clue. Yeah, the cryptic commenter is saying pemphigus. Very good. Pemphigus. So can we be more specific here? Pemphigus matlab which all types of pemphigus? Yes, pemphigus. Foliaceous, very good. Foliaceous and pemphigus vulgaris. And pemphigus vulgaris. Now, initially, when I just gave you this option, so you also told me that you can see it in toxic epidermal necrolysis, right? So you are absolutely right, because when we see a patient, when we apply a tangential pressure over the skin peels off. This clinically, ये जो sign है, it's going to be the same in toxic epidermal necrolysis also, but I'll just write it down in red, because in toxic epidermal necrolysis, we call it as pseudo-Nikolski sign. Pseudo-Nikolski sign. So let's be more specific when we learn MCQs, Because pseudo-Nikolski sign, the examples can be Stevens-Johnson syndrome or toxic epidermal necrolysis. Now, what is the difference? क्योंकि clinically तो same sign है ना, right? So clinically you are just applying a tangential pressure and the skin is getting peeling off. But why do we call it as a pseudo-Nikolski sign? The reason here is that the etiology is different, because the etiology is different here because there is no acantholysis. See, the meaning of acantho is a keratinocyte. Lysis means separation. So what do you mean by acantholysis? If these are keratinocytes, they are always glued to each other. They are attached to each other. So whenever a keratinocyte, they get detached from each other, this is called as acantholysis. So where do you find acantholysis? You find acantholysis in all these diseases. Acantholysis can be seen in staphylococcal scalded skin syndrome, pemphigus foliaceus, as well as pemphigus vulgaris. But if there is no acantholysis, still, if you are able to see the skin peeling off, that is the reason why we call it as a pseudo-Nikolski sign. So please remember two examples for pseudo-Nikolski. Two examples are Stevens-Johnson syndrome or toxic epidermal necrolysis. So that is all about Nikolski sign and pseudo-Nikolski sign. So shall I continue? So now going further to the next MCQ or the next clinical sign. New lesions, they appear on a skin, on a healthy skin after an injury. Guess the sign. So this is also a very common sign and also a very important sign for your exams as well. क्योंकि ये repeatedly asked topic भी है. What is this? Anybody? I'll just wait for your answer. I'm giving you few seconds for you to answer. If you want me to rephrase this sign, it is like new lesions appear in the skin whenever there is a trauma. New lesions appearing on trauma. So just see the image here. So in this image, what is a trauma that we can guess? Probably ये जो image है ना, यहाँ पे the patient has scratched his skin with his nails. So after scratching the skin with the nails, what has happened? The patient has developed multiple linear plaque lesions like this. All these linear plaque lesions, these are also having some whitish scales as well. So yes, this I got the right answer in the chat box. Anybody else? Someone in Telegram who is listening? So here the correct answer should be a Koebner phenomenon. So it is called as a Koebner phenomenon. So this Koebner phenomenon, this is also called as a isomorphic phenomenon. Isomorphic phenomenon. So what is happening in isomorphic phenomenon or Koebner phenomenon? So here what I can see is there is a red color plaque and a whitish kind of scales. So यहाँ पे मेरा diagnosis should be, anyone who would like to answer me so that it is not just one-sided. It is always great to have an interactive session, right? So any idea what should be the diagnosis? The clue is plaque lesions है और silvery white scaling भी दिख रहा है, whitish scales भी है. So what is the diagnosis here? The diagnosis here should be psoriasis. Very good. The diagnosis here should be psoriasis. Excellent. So here, please remember, what are the diseases where you can see a Koebner phenomenon positive? Koebner phenomenon, for you to remember, you can remember it as LVP. These are the three diseases where you can get a positive Koebner phenomenon, where L stands for, make it a guess. L stands for, take it as a revision session. L is for lichen planus. Any guess what is V? V stands for?
Vitiligo.
Very good. Sharan is answering it right. V stands for vitiligo. Gautam is also answering. So this is going to be vitiligo. And P stands for psoriasis. So understand, if this was a patient who was having lichen planus as a disease, so in the same patient, if a lichen planus patient would scratch over the skin, the patient would have developed some violaceous or a purple colored plaque lesion, right? So a patient of lichen planus will develop new lichen planus lesion because of trauma. A patient of vitiligo will develop some white color depigmented lesions because of trauma. So this is called as 𝐒𝐿 phenomenon. So any new lesion that is developing because of trauma, we call it as 𝐒𝐿. And remember few examples, that is lichen planus, vitiligo and psoriasis. So with your permission, I'm going to the next MCQ or the next clinical sign now. Now यहाँ पे क्या हो रहा है? There is a new lesion appearing, but not because of trauma, but because of auto inoculation, probably of a virus. Identify the sign. So just now when we discussed about 𝐒𝐿, yeah, I think the cryptic commenter, यहाँ पे ना, I have come to whatever doubt you have asked in the chat box right now. That is where we have landed with this sign. So instead of trauma, if there is a new lesion that is appearing due to auto inoculation of the virus, now tell me what is the name of the sign. It is something very closely related to 𝐒𝐿. So this is going to be, anybody who would like to answer? So this is called as pseudo 𝐒𝐿 phenomenon. So this is called as pseudo 𝐒𝐿 phenomenon. ये जो pseudo 𝐒𝐿 phenomenon है, just few seconds before I told you that 𝐒𝐿 is either also called as isomorphic phenomenon. So which means pseudo 𝐒𝐿 can also be called as pseudo isomorphic phenomenon. So for your exams, since everybody will remember 𝐒𝐿, I always think that it is more likely that the examiner can ask you, in which diseases can you see a pseudo isomorphic phenomenon? That can be more likely. And so here what happens is that imagine that this patient had a viral infection. So what is this viral infection from this image? So in this image, you can see that there are multiple papules, and in the center, there is a central depression as well. So whenever you see something with a central depression, आपका diagnosis होगा molluscum contagiosum, right? So here, the examples of a pseudo 𝐒𝐿 phenomenon can be molluscum contagiosum, as well as one more viral infection which you can give is going to be warts. It is going to be warts. Now, what is happening here? Just concentrate here carefully so that you understand the concept. That I'll just zoom this image for you. Imagine that a patient developed one molluscum contagiosum lesion here. So whenever we develop any new skin lesion, we always have this tendency to repeatedly touch this lesion, right? वो तो human tendency होता है. So once you repeatedly touch this lesion and then you touch the adjacent skin, normal skin, then what happens? The virus from here will get auto-inoculated here. Then this virus will get auto-inoculated to the adjacent skin, then to the adjacent skin. So one lesion followed by the other can be seen, and this is called as auto-inoculation of the virus, which causes many more new skin lesions to develop. And this usually happens in viral infections. That is why there is an auto-inoculation of the virus. So please remember, the name of this sign is pseudo 𝐒𝐿 phenomenon or a pseudo isomorphic phenomenon. Okay. So more than a immunological reaction or something that the cryptic commenter was asking. So this is more likely because of a direct spread of the organism from one lesion to the adjacent parts of the skin. That is called as a pseudo 𝐒𝐿 phenomenon. Clear? So now moving to the next one. Now this is a very specific sign. So let's see what is written. A rash that develops at the tip of the nose. It indicates the involvement of the nasociliary nerve, which is a branch of ophthalmic nerve. What is the sign called? Acne में भी यही होता है क्या? As people say, if you burst one acne, the new acne comes. See, acne, we don't see something called as a pseudo-Koebner phenomenon. क्योंकि acne में क्या होता है? Definitely there is a bacterial infection. जैसे, so I will just come back to this image again. So I'm just talking about the doubt that has been asked. क्योंकि क्या acne में भी pseudo-Koebner phenomenon देख सकते हैं? The answer is no. Because acne, if you see what is the organism that causes acne, then that is caused due to Propionibacterium acne or 𝐒𝐿 acnes. Okay, but this is the bacteria. In acne, when you just pluck on these lesions, and when you are going to break all those lesions, then what will happen is it can essentially lead to scarring of the lesions or disfiguring of the lesions. That is why we ask the patients not to pluck on these lesions. Instead, use topical ointments or creams or even oral tablets, right? So there essentially you don't see a pseudo-Koebner, but we never advise the patient to, scratch over these lesions or pluck over these lesions, because it can also lead to different types of scarring as well. Done? So that is the reason, but not because of pseudo-Koebner phenomenon. Now moving to the next one, I hope the query has been answered. So now when we come to this one, can anybody answer what is this sign? If you want, I'll just zoom this image for you. So what you see here in this image is, whenever you see an image, just try to describe the lesion. You can see that there is a red color rash, and I can clearly draw a straight line here, and I can clearly see that only one side of the face is affected. And the arrow mark here, this is showing that there is a lesion at the tip of the nose. And what does this indicate? Anyone? Please try to make a guess कि ये कौन सा clinical sign है? Yes. So I'm getting the answer that herpes zoster ophthalmicus. Very good. The diagnosis should be herpes zoster ophthalmicus because the lesions, they do not cross the midline. तो यहाँ पे diagnosis हो गया herpes zoster ophthalmicus. And herpes zoster ophthalmicus, this can be seen when there is an involvement of the nasociliary nerve, and which means that there is an involvement of the eye. It is a reactivation of the varicella virus, right? So the name of the sign, so we are talking about the sign here. So the name of the sign, as you have rightly answered in the chat box, this is called as Hutchinson sign. So this is called as Hutchinson sign. So when it comes to herpes zoster, when you see a vesicle at the tip of the nose, it implies that there may be an involvement of the eye. That is why you'll have to refer the patient to an ophthalmologist for an evaluation. That is called as Hutchinson sign. So when you're preparing for your exams in different subjects, you must have learned about Hutchinson sign. So before we go to the next image-based question, can you just quickly answer in which all diseases have you learned about Hutchinson sign? Hutchinson sign can also be seen in which all diseases? One disease, if you want, I can give you a clue, that is seen in a sexually transmitted infection, where it can be seen in children. Like a mother must have passed on this STI to a baby, and a child will present to you probably with a Hutchinson triad. Which is a disease? Anyone? So that can be late congenital syphilis. Okay, it can be late congenital syphilis. So what is happening in late congenital syphilis is the patient can present to you with a sensory neural hearing loss along with interstitial keratitis as well as Hutchinson teeth or Hutchinson tooth, isn't it? So those notching of the central incisor teeth, that is seen in late congenital syphilis. Also, there is one more where you must have learned this in surgery, where when there is a patient who is presenting to you with a head injury, there would be a unequal reaction of the pupils of both the eyes. So that can also be seen in head injury patients. Head injury patients. So be it in surgery, Hutchinson sign means something else because of head injury, the unequal reaction of the pupil. Whereas in congenital syphilis, late congenital syphilis, there is another Hutchinson sign. But in herpes zoster ophthalmicus, the Hutchinson sign refers to a vesicle at the tip of the nose, implies the involvement of the eyes. So that is how you need to correlate all these subjects together, especially when you are nearing to the exams. Clear? So now going to the next one. When a pressure is applied to the center of a blister and it starts spreading to the surrounding skin. So just see this image. So when I am applying a pressure, पहले क्या हो रहा था? When I was applying a tangential pressure over the skin, the bulla or the skin was getting peeled off. और यहाँ पे क्या हो रहा है? When you are applying a pressure over the bulla is not breaking easily, which means it's not a flaccid bulla. Instead, when you are applying a pressure, the bulla is moving in its direction. It is moving ahead. Now, what is this? Now, make a guess ki what is the sign that we are talking about. I really would prefer to get an answer either as an audio or as a message here in the chat box. Just try to answer, no problem if even if you go wrong. Just identify the sign. So यहाँ पे क्या हो रहा है? There's a bulla, and when you are applying a pressure, the bulla is moving. So this can be called as, should I give you time or should I answer? So this is also called as a bulla spread sign, or a variant of this one can also be mentioned as a, any idea? Asbo-Hansen sign. Asbo-Hansen sign. And what can be the examples where you can see this kind of a sign? The best example is, always remember, when you are applying a pressure to a bulla and the bulla does not break, it means that the patient is having a tense bulla. So when I give you a magic word like a tense bulla, can you make a guess कि कौन से diseases में can you see a tense bulla which does not break easily? It's an easy clue. What is it?
Bullous pemphigoid.
Very good, Charan. That is going to be bullous pemphigoid. So we can see a bulla spread sign or a Hasbo-Hansen sign in a disease called bullous pemphigoid. Or any other diseases जहाँ पे tense bulla होता है. जैसे pemphigoid gestationis. That is going to be bullous pemphigoid in pregnancy, right? Or it can also be seen in linear IgA disease. क्योंकि linear IgA disease में भी क्या होता है? There is a tense bulla. So when there is a tense bulla, whenever there is a tense bulla, you'll be able to appreciate a bulla spread sign or a Asbo-Hansen sign. So please keep this. Flaccid bulla, आप Nikolski sign देख सकते हो. या फिर tense bulla, you will be able to appreciate a Asbo-Hansen sign या a bulla spread sign. So that is all about this sign. So now moving ahead to the next one. A change was observed in a patient after stroking the lesions on the skin of a person with systemic mastocytosis. So diagnosis दिया हुआ है, that is going to be systemic mastocytosis or urticaria pigmentosa. The diagnosis is very well given here. So what is the sign that you can see? Imagine that I take a sharp object like the tip of my pen and then I'm going to stroke over the skin. I'm just going to stroke over the skin like this. So once I stroke over the skin and I wait for a couple of seconds, then what happens? The patient is developing this kind of a urticarial wheals after stroking over the skin. Now, what is the name of this sign? So the name of the sign starts with D. Anyone who can complete the name of the sign here? The name of the sign here is called as Darr sign. It is called as Darr sign. So this Darr sign, you must have learned Darr disease. But Darr sign is not seen in Darr disease. Darr sign is seen in systemic mastocytosis or urticaria pigmentosa. It is usually seen in children, and this is how the sign can be elicited. A very typical sign which shows cutaneous mastocytosis. Clear? Now moving to the next sign. Pinching the skin adjacent to a dermatofibroma causes a dimpled appearance on its surface. What is a sign? So now you can see here as well. Now there is a area of dermatofibroma. If you just try to pinch the skin, just say you're using your index finger and your thumb and you're just trying to apply a pressure, you're trying to pinch the skin like this. So once you pinch the skin, the lesion, it goes beneath the skin. The lesion goes beneath the skin. So once it goes beneath the skin, what happens? There is a dimpling. So this sign, what is it called? Try to make a guess. What is a sign? The sign that you see in dermatofibroma when you try to pinch the lesion. Then the question itself is giving you a clue. Dimpled appearance. So this is called as dimple sign. It is called as dimple sign. Because in dermatofibroma, what happens? The lesion is very adherently attached to the subcutaneous tissue. So since it is attached to the subcutaneous tissue, when you pinch, what will happen? The lesion will go beneath the skin. So this dimple sign, please remember, it is also called by one more name, and that name is Fitzpatrick sign. Fitzpatrick sign. So these are the two different names of the same sign, that is called dimple sign, yeah, Fitzpatrick sign. Remember that we can see them in a disease called dermatofibroma. Can be seen in a disease called dermatofibroma. अब ये हो गया बहुत easy question है, and this is a very specific question as well. So this answer I'm not going to give you. You will have to answer. Raised inflamed lines started appearing after scratching or stroking the skin with a pointed object. अभी पहले क्या हो रहा था? Like when I discussed about this condition, यहाँ पे after stroking the skin, the patient developed an urticarial wheal, right? But now in this patient, what is happening is, if I'm stroking the skin like this, after stroking the skin, the patient is developing what? Urticarial wheals exactly over the lines wherever I have stroke. Like if I just take my pen, if I just write your own name over your skin, the entire urticarial wheel will appear just like the alphabets over the skin. What is this phenomenon? Very, very typical phenomenon.
Dermographism, sir.
Excellent. So this is called as dermographism. So please remember, this phenomenon is called as dermographism. And to be very specific, this image, what you can see here, this is going to be red dermographism. So red dermographism, to be very specific, it can be seen in chronic urticaria. It can be seen in chronic urticaria. Whereas in some patients who is having a chronic history of allergy, okay, so in those patients, if I'm going to stroke over the skin, then what happens is, instead of appearing wheals, the patient's skin may turn white in color. So after stroking, if the skin turns white in color like this, at that time we call it as white dermographism.
Right.
It's called as white dermographism. Now, can anybody answer what is the name of this disease where you can find a white dermographism? So, yes, AD.
Atopic dermatitis.
Excellent, excellent. So that can be seen in atopic dermatitis. Amazing. So this is seen in, yes, Kishore is also answering, AD is answering, everyone is answering it right. So that is going to be atopic dermatitis. So please remember, for your exams, what is important is your eyes should be able to see whether it is a white dermographism or a red dermographism. And definitely in the MCQs, chronic urticaria as well as atopic dermatitis will be given as options. So if you are able to identify it correctly, you will not make a mistake. You will not make a mistake. So that is all about dermographism. So now let's go to the next one. So in this next one, lesions, they have a tan zone of varying width between the normal and totally depigmented skin, which exhibits a intermediate hue. What is the sign that is shown in the image? Okay, chalo, let me explain it with the image itself. In this image, what I can see is in the central part, all of you can see that there is a white color skin. मतलब ये हो गया depigmented skin. So in the central part, there is a depigmented skin. Immediately after the depigmented skin, if I just draw a line, we can see that ये जो region है ना वहाँ पे थोड़ा tanning है, isn't it? Darker skin, hyper pigmented skin. तो ये हो गया tanned skin. And after that, you can see that there is a normal skin. Abhi, how many colors are there? Depigmented skin, tanned skin, and a normal skin. So when you see three different colors, one after the other, what is the name of this kind of a sign? The clue for you is three colors. Three colors is a clue.
Trichrome sign.
Excellent. So this is called as trichrome sign. So this is called as trichrome signs. Kishore is also answering. Charan has also answered. So this is called as a trichrome sign. Can you tell me in which disease or what is the diagnosis when you see that a patient is having a trichrome sign visible in the skin? Ha, Gautam. So very good. So the diagnosis here is, yes, Rishabh. Answer is going to be vitiligo. Vitiligo. So in vitiligo, we can see this very specific sign which is called as a trichrome sign. Very good. So now let's move to the next one. So here what you can see is patient presented to the OPD with a circular discoloration of the nail bed that looks like a oil drop on a piece of paper. So that is how this nail finding is now explained. It looks like a oil drop on a piece of paper. अभी जल्दी diagnosis बताओ पहले. What is the diagnosis? Tick tick one. What is it? Diagnosis is, the clue is it looks like a oil drop on a piece of paper which can be seen over the nails. Yes, very good. AD is answering it as psoriasis. I completely agree with you. यहाँ पे diagnosis है psoriasis. So in psoriasis, this typical nail finding, this is called as oil drop sign. It's called as a oil drop sign. And remember, oil drop sign is the most characteristic nail finding when it comes to patients of psoriasis. Okay? It's the most characteristic nail finding in patients of psoriasis. Now, erythroderma, what is erythroderma? See, erythroderma means it is not found in the nails, it is in the skin. So erythroderma, the meaning is when 90% of our body, of our skin turns red in color, it is called as erythroderma. And erythroderma can be seen in different diseases. Examples ho gaya psoriasis, severe cases of atopic dermatitis. In the cases of cutaneous T-cell lymphoma, जैसे mycosis fungoides. So in all those cases, you can see erythroderma. पर यहाँ पे what you can see is a red color, I agree. But this red color is compared to a oil drop sign that can be seen. And that is seen in, yeah, it is also called as a salmon patch as well. Very good. It is also called as a salmon patch. So do you remember कि other than nails or कहाँ पे we have learned about a salmon patch? Did you learn about a salmon patch in the skin as well as a vascular anomaly? है ना? Which is called as an angel's kiss or a stork bite when a baby is born with a salmon patch, right? And it disappears by around 1 year of age. That is a salmon patch in the skin, whereas salmon patch in the nails is called as a oil drop sign in psoriasis. No worries, whatever mistakes that you do today, it's all fine. So we are all in a learning process, right? So, but whatever mistakes you do right now, it's all fine, because if you do a mistake, you will always remember that and you will not make a mistake on the day of the exam. That's completely all right. So now coming to the last sign for the day, that is going to be a presence of axillary freckling in a patient with neurofibromatosis type 1. So what is the name of the sign? 𝐒𝐿𝐼. We are very close, but it's not correct. Because 𝐒𝐿𝐼 is separate finding. Can you tell me the name of the sign here? Yeah. Yeah, very good. So this is called as a Rove sign. So you're very close, because 𝐒𝐿𝐼 macules, if I just zoom this, so in this one, this brown color hyperpigmented patch, this one you can call it as a 𝐒𝐿𝐼 macules. This one you can call it as a 𝐒𝐿𝐼 macules. Calm. Whereas when you see that in this image, you can see there are multiple small brown colored macules over the axillary region. ये जो multiple brown colored macules हैं, all these are called as axillary freckling. So this axillary freckling, which can be seen in patients of neurofibromatosis, this is considered to be the most pathognomical feature. And this pathognomical finding that you can see is also called by a sign, and the name of the sign is 𝐒𝐿𝐼 sign. The name of the sign is 𝐒𝐿𝐼 sign. So these are some of, since it is only a half an hour session that we had today, that is why I have only added very few signs here. So, but before we wind up the session, let me just ask you, what are the other kind of signs that you remember in dermatology? So we'll just write down few more signs in dermatology before we wind up the session. So now it is all up to you in the chat box, or you can just speak it out. What are the signs that you remember? Any other signs?
Buttonhole sign, sir.
Very good. Buttonhole sign, says Rishabh. So buttonhole sign, in which disease can you find it? So buttonhole sign, please remember this again, you can find it neurofibromatosis 1. Because when you try to press over the lesion again goes beneath the skin, just like how you insert a button into a buttonhole. Now that you have told about a buttonhole sign, let me also write down there is something called as a button sign. So where do you find a button sign? The clue is button sign matlab the button that you have in your shirt or your t-shirt. Just like how you can hold the button, similarly you can hold a genital ulcer. So in which disease can you get a genital ulcer with a raised edge where you can hold it like a button of your shirt? Answer kar sakte ho? Can you try to make a guess or recollect from what you have learned? Indurated ulcer, genital ulcer. So this can be seen in primary syphilis. Okay, it can be seen in primary syphilis. Now, can you also just try to brainstorm some more signs if you are able to recollect any other signs in dermatology? Yes, Eddie, that is seen in chancre, primary chancre, that is primary syphilis. Okay, very good. Any other signs? क्योंकि आज हमने डिस्कस किया निकोल्स्की साइन, we discussed about Koebner phenomenon, we discussed about pseudo Koebner phenomenon.
Sign, sir.
Which one?
Empathy sign.
Okay, where is it seen?
Strawberry hemangioma.
In strawberry hemangioma, very good. So in strawberry hemangioma, like we can see this emptying sign, isn't it? Like when you, since it is a capillary hemangioma, when you just try to press on the lesions, the reddish color may disappear. Once you take it, take your hands off, it may again come back. So this can be seen in capillary hemangioma or strawberry hemangioma. Excellent. So is there any sign that you can see in the patients of discoid lupus erythematosus? Discoid lupus erythematosus. Like the scaling that you can see in a DLE patients, it's so adherent to the skin that if you just try to, peel them off, it is so adherent to the skin that once you try to peel them off, you are able to elicit another sign here. So any idea what is that? So remember, that is called as a carpet tack sign. So now Gautam is saying that there is shawl sign that they have learned in dermatology. Amazing. So let's write down shawl sign. Shawl sign. So like how you wear a shawl, if you can find a photosensitive rash on the back area, so in which disease can you see a shawl sign? Bhavna is saying V. Chalo, theek hai. V shaped erythema also. So both these things can be seen in a single disease. Kaun disease? Yeah, this is called as dermatomyositis. Dermatomyositis. Amazing. Very good. So all these are the various types of signs that we can see in dermatology. So what all of you can do is, while you have gone through your notes and all, just try to write down all these signs like this as a table. So just write down the name of the sign as well as the name of the disease where you can find these kind of signs. And definitely before your exams, we'll again come together to discuss many more other diseases or other important things for your exam as well. Okay? So that is all about this today's short session. So Kishore is adding one more. So all of you are, I think that you're brainstorming now. So Kishore is saying nutmeg grater sign. Nutmeg grater sign. So just like the nutmeg grater that you have in the kitchen, so the skin may feel very rough when you try to palpate over the skin. That is because of follicular hyperkeratosis. So in which disease do you find all these things? Yeah, so this can be seen in pityriasis rubra pilaris. Pityriasis rubra pilaris. Yeah. And before we wind up this session, one last question, because once you interact, it also motivates me to ask more questions. Last one question of the day before we wind up. So where do you find a exclamatory mark sign? So all of you know that an exclamation mark looks something like this. The clue for you is this is seen in a condition of the hair. Excellent. So Rishabh is answering alopecia areata. Alopecia areata. See, the entire signs in dermatology is now all coming in our chat box now. Gautam is adding one more sign, that is hanging curtain sign. Chalo. Hanging curtain sign. Hanging curtain sign. So where do you find this hanging curtain sign? Yeah, alopecia areata is right. So whoever is answering it right, excellent. So Abhi, hanging curtain sign, where do you find it? Yeah, learn and teach. You are also answering it right. Alopecia areata, very good. Hanging curtain sign is again seen in another pityriasis. What is the name of that pityriasis? So that is called as pityriasis rosea. It's called as pityriasis rosea. Very good. Amazing. Okay. So that's it. If anybody would like to add more, I'm more than happy to stay back for some more time. Exclamation mark here is what we added. Nutmeg grater sign is what we added again. Shawl sign we added. Hanging curtain sign was added. Okay. want more sessions like this with definitely Gautam. We'll definitely come back with more sessions. Yeah. So thank you so much, all of you. So we'll be sharing this annotated PDF as well in the Telegram group in some time. So it was nice to interact with all of you, and answering all these questions really makes us believe that all of your preparations are going well on track. So keep preparing well, and we will definitely come again with many more such sessions. Thank you so much. Yes, Gautam, laser sign. Very good. Laser sign can be seen in, it's a marker of malignancy, especially in GI adenocarcinoma. Okay, that where you can see multiple seborrheic keratosis. Okay? Thank you so much. So we'll again be in touch with all of you. So winding up the session.